We heard the Premier come out and say, okay, we've got out of the tunnel now. We saw the light, now we're out of the tunnel, but the train has been demolished in the process. And in order to fix things or to keep us on track, we need more nurses, for instance, but it's going to take 3 to 5 years to train them. We're also going to have to learn to live with the virus, which might have more variants, more outbreaks, more waves, etc. And we're going to have to do all of that with a broken down train and a lack of staff. How do you interpret that? Does that mean that for the next 3 to 5 years, we're going to have to live with a healthcare system that is broken, that is going to crack at the smallest wave, at the smallest, we're going to just be able to, flick it and it's going to come crumbling down? What is your interpretation of that?
What I know is that the train was already in very bad shape when the pandemic began. Quebec is one of the places in the world with the lowest hospital capability because of political choice made in the past by governments of the Parti Québécois and the Parti Libéral. So it is true that the train is in very bad shape today, but it was already in bad shape even before the virus came in Quebec. And what we need to be doing right now is fixing the train. And punishing unvaccinated Quebecers will not fix the train. It will not help us get this symbolic train in a better shape. That's what we should be doing this session, not debating about a vaccine tax that in no shape or form will help us get out of the crisis.
So how do we fix it? I'm sure you guys are going to be talking today in caucus about your own solutions. What is the first thing that we need to do? What is the first thing we need to debate?
My colleague Vincent Marissal put forward a very comprehensive plan a few months ago, outlining all the measures that Quebec solidaire is proposing to help the staff come back inside our public health system. The other thing we should be doing to indirectly help the system is better protecting Quebecers against the virus. And we can do that. We can do that by distributing N95 masks massively in Quebec for healthcare workers, but for all frontline workers, to make sure that there is less transmission. If there's less transmission, there's less cases. If there's less cases, there's less hospitalization. If there's less hospitalization, it's less pressure on the staff. It's better working conditions. So there are solutions, but we need to keep looking for them and applying them, not divide Quebec society with a measure that is much more a punishment than a solution.